Hello! Today I'm going to demonstrate how to use an Aerochamber with the help of my monkey to help explain the process of using this device for respiratory medications. As pharmacy technicians, it's important for us to know how to teach patients how to use their devices properly. And so this is the Aerochamber that I have. It might not look the same, but it will be very similar. There are three main parts. So there's the mouthpiece, which is here, the chamber itself, and the valve. The inhaler fits in this end of the chamber. So the first thing that we would do is we would shake the inhaler just to make sure, unless you're not supposed to shake it, but this one specifically says to shake well before use. It's salbutamol. And so once you shake it, this will mix medication, and it's very crucial to ensure that the right dosage is delivered. And then what you'll do next is make sure that this is upright, and then you'll see that you can slot it in there nicely. Oh, mouse is coming to visit. Okay, so now we have this set up. So we'll get Mr. Monkey here to exhale fully, to completely empty their lungs before using the device. What we'll do is we will now place the mouthpiece of the Aerochamber around the patient's mouth, ensuring a tight seal around the lips, the nose, everywhere. And then we'll press the inhaler down to release dose into the Aerochamber. And then we'll instruct the patient to breathe in slowly and deeply through the mouthpiece. The valve will open and close, indicating that the medication is being inhaled properly. Now, since the monkey can't actually inhale, we can't see that, but you would be able to see it right there. And now the teddy will hold their breath for a few seconds. We'll ask the patient to hold their breath for about 10 seconds to allow the medication to settle in the lungs, and then they can exhale slowly. Now you can repeat if necessary, if another dose is required, and you should wait about 30 seconds before repeating the steps. So there we go. That's how you use an Aerochamber with a metered dose inhaler. Always remember to clean the Aerochamber regularly as per the manufacturer's instructions. And if you have any further questions, I can totally feel free to reach out to the pharmacist or healthcare provider. Thanks for watching.